3D Anatomy Masterclass, the Scapula, Shoulder Blade. Welcome to 3D Anatomy. Today, we are diving deep into the scapula, commonly known as the shoulder blade. For therapists and trainers, the scapula is the mechanical hub of the upper body. Misalignment here leads to chronic neck pain, rotator cuff tears, and restricted mobility. Today, we won't just memorize names, we will visualize them in 3D to elevate your clinical practice and ace your exams. 1. The 360-degree overview. Let's look at the right scapula. Visual, 360-degree rotation of the bone. The scapula is a triangular bone sitting on the posterior thoracic wall. To understand it best, we always start from the posterior view, the back, as this is where its most defining landmarks are located. Posterior landmarks, the back. Starting from the top. Superior angle. This sharp upper corner is the attachment point for the levator scapulae, the stress muscle of the neck. Clinically, we use this as a landmark to check if the shoulders are level. Medial border, vertebral border. This inner edge runs parallel to the spine. It's the anchor for the rhomboids. Training the muscles along this border is the key to correcting slouched posture. Inferior angle, the bottom point. This is a vital landmark for the teres major and latissimus dorsi. Pro tip for trainers: during a lat pull down, watch the inferior angle. Its rotation tells you if the client is engaging their back correctly. The 2 to 7 rule, exam essential. In a neutral posture, the superior angle aligns with the T2 second thoracic vertebra. The inferior angle aligns with the T7. 2. The spine and the fossas. Now, look at this prominent ridge, the scapular spine. Visual, tilting the model to show the protrusion. The word spine here means thorn. This ridge divides the back of the bone into two bowls, or fossae. Supraspinatus fossa, above the spine, home to the supraspinatus muscle. Infraspinatus fossa, below the spine, home to the infraspinatus muscle. Both are critical members of the rotator cuff. Following the spine outward to the very tip of the shoulder, we find the acromion. This is the highest point of your shoulder and forms the roof of the shoulder joint. 3. The lateral view, the socket. Let's turn the bone to the side, lateral view. The first thing you notice is this shallow pear-shaped socket. The glenoid cavity, glenoid fossa, this is where the head of the humerus arm bone sits to form the shoulder joint. Look closely at the top and bottom of this socket. Supraglenoid tubercle, top. Attachment for the biceps brachii, long head. Infraglenoid tubercle, bottom. Attachment for the triceps brachii, long head. Memory, trick, biceps are on top, superior, triceps are on the bottom, inferior. 4. The anterior view, the front. Now let's look at the side that faces your ribs. Coracoid process. This hook-like projection looks like a crow's beak, from the Greek korakoids. It's the attachment for the pectoralis minor. If this area is tender to the touch, it's often a sign of rounded shoulders or restricted breathing. Subscapular fossa. This large, smooth, concave surface fits perfectly against the curve of the ribs. It houses the subscapularis muscle. 5. Clinical perspective. The ribcage connection. Looking from the top down, notice that the scapula isn't flat, it's curved to follow the ribs. Because of the ribcage's shape, the superior angle sits slightly more forward than the inferior angle. Understanding this, scapular plane is essential for safe overhead pressing and manual therapy palpation. Summary and review. The angles, superior, T2 and inferior, T7. The spine separates the supraspinatus and infraspinatus. The socket, glenoid cavity flanked by the biceps, top and triceps, bottom attachments. The hook, coracoid process for the pec minor. Knowledge, check. Can you name the 3 muscles that attach to the medial border, the coracoid process, and the glenoid tubercles? If you found this 3D breakdown helpful, hit the like button and subscribe for more deep dives into human movement.